Hey there guys. Alright, so we're going to go ahead and go over art lines. First we're going to talk about what comes inside your kit as well as how to prime the tubing. So this right here is your art line tubing. This comes inside the kit. They are located. There's one in the trauma cart as well as one in the clean utility room. Dave usually has two made up at all times. And please remember, there is a sheet of paper that comes inside that art line kit. Please give that to the secretary so that Dave can go ahead and reorder the supplies and make a new kit. All right, so it is going to come with your tubing here, and then you'll also need a liter of saline or a 500 bag of saline and a pressure bag. Please just make sure that your pressure bag is for the same volume as your bag. So if you're using a 500 bag, please make sure you get the 500 ml pressure bag. And obviously if it's a liter, then the liter pressure bag. Okay, so we'll set these two aside. Let's go over this tubing kit. So you're gonna go ahead and open it up. And you wanna do all of this aseptically. All right, so you're gonna empty out your kit. You will have two tubings. You'll have your tubing that connects directly to your bag of fluid. And then you will also have your tubing with your transducer, cable cord, and vamp. Okay, so this is the cable cord. This attaches to the cable that attaches to the monitor, which is also located in the trauma cart on the bottom left-hand drawer. It should be right underneath those art line kits. This is your transducer here. This right here is called your pigtail. I like to call it a plunger because it does what a plunger does and it flushes. This right here is your vamp. This is your device that holds the reservoir that holds your blood when you're drawing blood as a waste. Okay. So inside your bag here also comes this little baggie that actually has some stickers that are markers, whether you're putting in an art line, a CVP, and then also this non-vented cap here. Okay, make sure you don't toss this on the floor or anything. This is a very important cap, and I will show you why in just a moment once we get our tubing primed here. First thing you're going to do is you're going to attach your tubing that connects directly to your saline bag to the top of this transducer. Okay. Next thing you will do is this vamp will actually come erect like this in the tubing. So you do need to make sure that you push it down before priming your tubing. Okay. So now that you have done that, we are going to go ahead and get our bag of fluid. Again, our policy says a 500 bag of 0.9, but a liter bag of 0.9 does just as well. LR doesn't really matter, but 0.9 is what will be in our kits. So first thing you're going to do is you're going to burp your bag. So you're going to go ahead, spike your bag. And now before flipping it over and filling up your chamber, you are actually going to remove the spike. And remember, keep everything as aseptic as possible. And you're going to squeeze all the air out of your bag. Now, each bag of fluid comes with about 100 cc's of air, and then you're gonna just re-spike that bag, okay? And now you're ready to put it into the pressure bag. Your bag does need to be pressurized when you flush your tubing. So this is the next step. Go ahead and insert it here. And there's this little hook here inside your pressure bag where that bag of fluid actually hooks on there. Okay, so I'm gonna pretend like this is hanging right now, but for videoing purposes, it is not. We're gonna make sure that our stopcock is turned off to the atmosphere right now so that we can pump up our pressure bag. We're gonna pump it up to 300 millimeters of mercury of air, and that is an indicator right here. So there's two white lines and then there's a green line as well as a red line. So green means go, and that's the amount of pressure you want to have when priming and having your art line functioning. this is getting a little hard to hold. There we go. All right, can you still see me? Okay, so pump, pump, pump. Get that workout in. Pump it up real good. Chicka, chicka, yeah. I know, don't worry guys, the singing comes free in all videos. There will be a little bit of singing, some bad dad jokes, and lots of puns, okay? I'm a very punny person, so don't you worry, that all comes free of charge though. Not that I'm charging you for these videos or anything, but anyways, all right. So, pump it up, almost at green here. Woohoo! All right, so once you reach green, you want to go ahead and turn your stopcock off towards the bag. That reduces the amount of air that'll leak out, and as you can see here, see it's green there, which means that I have reached the perfect amount of pressure. All right, I'm gonna hang this up. You're gonna pull up on your pigtail, give it a nice pull, and slowly watch as the fluid starts to prime, okay? And again, remember, your pressure bag needs to be pressurized in order to prime this Artline tubing. Go nice and slow to avoid having any sort of air bubbles in there. And I'm just dumping it into a cup over here. All right, keep going, prime it. Again, I have a lot of bubbles because I've primed this thing so many times. Okay, so I'm almost done here. All right, so I have no bubbles. I'm gonna go ahead and take a look at my transducer here. Make sure that there's no bubbles sitting in there either. Again, I have primed this thing so many times, so sometimes I have a little bubble. Okay, so now that we've actually used some of this fluid to prime, I've probably used about 100 cc's just because, again, my tubing here has been used so many times. So I'm just gonna go ahead and give this another pump here. Another pump here just to make sure that my pressure stays nice and adequate. Green means go. All right, cool. So the next part, remember that handy little white cap I told you not to throw on the ground and not to lose? So the reason why that cap is in there is because the cap that comes right underneath your transducer there, this cap, it has a hole in it, okay? So that is a vented cap. That means that water, blood, whatever can leak through there, okay? So the reason why that is there is because we need to actually prime that port. So you're gonna go ahead and turn your stopcock off to the patient, which is down away from the transducer. You're gonna go ahead and undo the cap. And now you're gonna pull up on your pigtail there and give it a nice little flush and make sure that that is flushed. You're gonna go ahead and grab your white cap that comes in this little thing. Again, keeping all of this as aseptic as possible. And you notice how on this one, it is a non-vented cap, okay? So even if I tried to flush through here, nothing's gonna go through. So you wanna make sure that after you flush this cap, you actually turn it back off to there, okay? Double check your tubing again, make sure you don't have any sort of air bubbles. Okay, looking pretty good. Check your vamp, make sure that's good too. All right, that looks good. All right, so now once your provider is done putting in your Artline, they're gonna tell you that they're ready for your tubing. You're gonna go ahead and hand them the tubing. Okay, and then you're gonna, on the monitor, you'll press 0. I find that our monitor, sometimes you gotta hold it down a little bit and wait for the beep. Okay, so you're gonna press 0, but when you press 0, we actually wanna make sure that when we're zeroing out the transducer, we are off to the patient, so our stopcock is down. We open up this side port that we just capped, and that is open to atmospheric pressure now. Okay, so now we are gonna press the 0 button on our monitor. because zeroing means that it is getting adjusted to the atmospheric pressure so that we make sure that we have the right blood pressures essentially. So I'm gonna undo this cap. You're gonna zero it out. It's gonna beep. It's gonna have a straight line. You're gonna recap it. Oops, sorry guys. You're gonna recap it here. You're gonna go off to atmospheric pressure and you're gonna watch your monitor and you're gonna get a waveform and you're gonna get readings, okay? And now, the moment you have all been waiting for. Drum roll, please. Bart the Art. All right, guys, so this is Bart. He is my art line that I created. This is going to be used to simulate how we draw blood off of the art line when we need a sample. Okay, so first things first is, again, we'll go over the terms of everything. We are going to use our plunger here. That is going to be used to flush. Here we have our vamp. This is the reservoir that holds the blood so that we don't have to waste any precious arterial blood. This right here is the stopcock that we are going to turn when we are drawing the blood. And this right here is the hub that we will be drawing the blood off of. Okay, so first things first is, your provider tells you, hey, I'm gonna need an arterial sample from this sweet art line that we just put in. And then you're gonna say, not a problem, I can help you with that. First thing we're gonna do is you're gonna go ahead and pull up on your vamp here. Again, this reservoir right here is used so that we don't have to waste any of Bart's arterial blood. Think about having to have wasting every half hour if we need like 30-minute ABGs of arterial blood. Now that would not be good, right? We're depleting them of a lot of blood. Next, what you're going to do is you're going to turn this stopcock off to the patient. So when it is straight, that means it is flowing to the patient. As you can see here, there's a little hole. So you can see that that's the hole that the blood actually flows through. So if you can see it, then the blood can't flow through there. Okay, next, just like any other port that we are accessing or hub that we access, you're gonna go ahead and scrub your hub. Scrub it real good. We don't want any sort of infections going into that sweet art line. All right, so next what you're gonna do is you're gonna locate the saddle hub that actually comes inside that art line kit that we have stored again in the trauma room and or the clean utility room. Dave is putting these in the kits now, as well as go ahead and grab like a 3 ml syringe, maybe a 5er, depending on if you need to get any other blood from the art line as well. So this is your rider, this is your horse, and this is your saddle. Your saddle and rider always, always, always get on the horse together. So go ahead, screw that on, and always remember that the saddle goes on with the rider and the rider comes off with the saddle. You never want to have your saddle on your hub and unscrew this lure lock, because guess what's going to happen? Arterial blood splashing all over the place. No bueno. All right, so we're going to go ahead and put our saddle on our hub, and then you can go ahead and draw back for your ABG. Get your sample there. And now I'm going to unscrew my lure lock. Just kidding. Making sure you're paying attention. Now my rider is going to come off with my saddle. And there's your sample. Pretty sweet, right? So we're going to go ahead and set that aside. We're going to give Bart his blood back. So first thing we're going to do is we're going to go ahead and turn the stopcock back straight, making that hole aligned with the tubing. That way we can go ahead and give him his blood back. You're going to squeeze up on these, press your vamp back in, and give him back that blood. Now you're probably thinking to yourself, hey Kathy, there's still blood in there. And I like to call those skid marks because, hey, don't act like you've never seen a skid mark before, right? You're gonna go ahead and pull up on your plunger here and flush out those skid marks because nobody likes a dirty toilet. And there you are. Your provider the tubing, they screw it on, they'll either tegaderm it on, suture it on, stat lock it on, whatever they have available and however fancy they are feeling. Next important piece is this transducer here. We want to make sure that this transducer is placed at the phlebostatic axis. The what? The phlebostatic axis, aka the level of the heart. So what we like to do around here is tape this transducer. You can tape above and below it and put it on the patient's left side as close to their heart as possible. Probably a little lower on their arm here because remember your heart's not super high up. So a little bit lower, make sure that it's at the level of their heart. Between like the 4th and 5th intercostal space is what they say. And that'll give you the most accurate pressures. So if you tape this somewhere else, say you tape it to like the side of their mattress or something and they're intubated or whatever, but you know, somebody comes along and ends up propping them up on 2 pillows, then their phlebostatic axis is no longer flat. You need to also make sure that your transducer goes to the same angle as the level of your heart, as your phlebostatic axis. All right, guys, so let's talk waveforms and what waveforms should look like with an art line. So your waveform with an art line is going to be a nice smooth hill, a little bit of a tooth coming down, back into a nice smooth hill, a little bit of a tooth coming down. Okay, so let's talk about what this waveform actually represents. This area right here, this down slope right here, let's use another color, represents systole, okay? This peak with downslope right here represents, you guessed it, diastole, okay? This right here, that little, what I kept calling like a tooth, it's this little notch right here. This is called the, ooh, can you see that? You can't see that. This is called the dicrotic notch. And what this represents right here is the aortic valve shutting. Okay? So it's very important to have this waveform when you have your art line in place. Now your waveforms can look a little different, and sometimes you'll have a waveform that looks almost like an SpO2 waveform. Like that, just nice little waves. Do we see a dicrotic notch here? No, no dicrotic notch there. So how can we tell that that waveform is actually an accurate blood pressure? That's the problem with that waveform. Sometimes you might get a waveform that looks like this. A super spiky one, a hedgehog. So this waveform is also not the correct waveform. So let's talk about what these two waveforms are called. These two waveforms are called, this one is called an over-dampened waveform. This one is called an under-dampened waveform. So a nice way to kind of think about it is with hair, actually. So this one is the best of both worlds, right? Having a nice good hair day, not too many frizzies. Now, if my hair is super damp and it's all wet, I mean, I look like a wet dog. My hair is just straight down sticking to me, and I look like a wet dog. I really do. So now if it's under dampened, if this doesn't have enough dampening, as we call it, what does it look like? Super spiky, right? Super frizzy hair. Hair's going all over the place, right? So this is a over-dampened waveform and an under-dampened waveform. So what can these two waveforms be? Maybe I should just fix it up just a little bit. There we go. No, I'm having an okay hair day. How about it? All right. So what do these two waveforms mean? It can mean that there's a kink in the system. They say that sometimes the over-dampened waveform can be something like an air bubble because it can still pass through, but it kind of slows things down a little bit. So if you get an over-dampened waveform, you might want to look for something like an air bubble. Now, an under-dampened waveform, you see how it's super spiky like that? That could most likely be a cause of some sort of other obstruction, maybe a kink or something like that. So definitely check all of your tubings, make sure that there's no air bubbles, make sure that you don't have any kinks, make sure that your transducer is at phlebistostatic access. Sometimes with either of these, also the catheter itself, the radial catheter or the femoral or the axillary or wherever they decide to put it, might be up against a valve. So maybe try fiddling with that a little bit, moving it a little, and seeing if that makes a difference in your waveform. So again, the dichrotic notch, it's important to see it, and important that you have a well-dampened, a good hair day, okay? A well-dampened waveform. You need to have the well-dampened waveform. Don't come to me with no wet dog hair. Ain't nobody gonna like that. And definitely don't come to me on a frizzy day, because that is a bad day for me, I will tell you that. Oh, baby's born. And so that is what your waveform should look like. So again, some troubleshooting. Check your tubings, check to see if you don't have any microscopic bubbles somewhere, and go from there. Just lots of troubleshooting with that stuff. All right, y'all, well, that's my first video. I plan on doing more of these with different items like chest tubes, transvenous pacing, all sorts of other things. I hope you guys love this method. Attached is gonna be like a 5-question little quiz thing. Nothing crazy, but I hope you guys enjoyed these videos. Please excuse my editing and stuff. I'm like a grandmother when it comes to technology, and I'm really working on it, and I hope the videos just get better and better from here. And let me know if you guys have any questions or comments. Thanks.